Hey everyone, this is John Hansbrough with the LBL Group. Wanted to come to you with another explainer on something that I've been thinking about lately with healthcare. I heard this analogy the other day and I wanted to share it. It's pretty good. Um, we don't really think about healthcare from a consumer standpoint, right? And so I think everyone expects the healthcare industry to be complicated and opaque and completely untransparent. So when we compare it to another common thing that we're all familiar with, I think that really draws out that contrast. So think about when you go to the grocery store. Let's say you're walking through the aisles, you're picking up some chips, you're picking up some milk, eggs, some burgers, maybe some veggies. What are you doing? You're usually looking at the prices for everything, right? You're seeing that this carton of eggs costs $3, that carton of eggs costs $4. You're making value buying decisions in those kinds of circumstances. Well, in healthcare, we're not doing that. So you may have, let's say, two local hospital systems you might go to for a procedure. Let's say you're getting a knee replacement done. Well, one hospital is telling you that through your insurance, you're going to get a discount of 40%, and the other hospital is saying it's going to be a discount of 30%. Well, those hospitals could have wildly varying charge master costs for those knee replacement surgeries. So whether you're paying $25,000 at hospital A or $20,000 at hospital B, that's still multiple times what Medicare would be, for example, paying for a knee replacement. And so there's this lack of understanding at the employee and the consumer level for what healthcare costs are going to be for them for any kind of consumption, right? And in the typical way that that works is that instead of having insurance cards that helps consumers be more proactive, helps consumers be more proactive consumers of healthcare, insurance cards typically just operate like a credit card. And they're credit cards for hospitals and providers and all the different people who are taking money in from your employees going and getting healthcare done. They're all using that money and swiping it, and that's revenue for them. The health insurance companies, the way they're typically operating is that they're fine with that because they're getting a set portion of every premium dollar is their profit. So when premiums go up, their profits are going to go up. So there's a complete mismatch of incentives. And so in order to combat that, one of the things that we're trying to push for employers to be doing is taking control of their data, because all of that is going to start with data. And in so many other companies today and so many other industries, data is driving innovation, it's driving effectiveness, and it's driving cost savings. And right now, we're trying to do that in healthcare because that doesn't typically exist. Most employers don't know how much they're spending on drugs. They don't know how much they're spending on specialty drugs, on cancer treatments, on knee and back surgeries. They don't know those kinds of things. And so that's where you'll see these crazy reports out there about an $8 tissue that someone receives. Maybe it's a $50 Band-Aid that someone receives in the ER. And to combat that, we need healthcare data. Employers can push for this by working with us. We can go out there, help them work with plans where they're going to be able to get their data on what usage looks like. Because the cost of something is going to be the total cost of it per instance used, right? So it might be, you're going to understand that Band-Aids are going to be, 20 cents per Band-Aid. And so if you have a pack of 10 of them, it's $2. That's what we're trying to do with healthcare. We're trying to say, address the number and frequency of your claims, as well as the typical cost per claim. If we can work on that, we can identify what's driving the cost growth within your organization, and we can fight it. We can bring that down. And coincidentally, the way healthcare usually works is that the lower cost you're paying for something, the better quality you might end up getting, right? Because the procedure or the provider who's typically doing that procedure, every single day, and day after day, year after year, they're going to be able to perform it at a lower total cost than maybe the surgical center who they're doing a ton of different procedures. And so there's all these different wrinkles to how we can find cost savings for groups, but it's going to start with employers demanding that they have access to their data. And that's where we can come in, help you understand how to first collect your data, and then once you have it, how to understand it, right? Because once you have your data, you need to understand it. You need to be able to analyze the analytics. You need to analyze the trends, and you need to have just a general understanding of the healthcare landscape to find those cost savings opportunities. And so that's where, when an employer is able to get control of their data, they're able to analyze their claims, we can actually go in and help find employees better care options, getting them better outcomes, and also possibly finding them lower costs. And those kinds of things are going to cause some variability, but we know that working with employers year after year, we know that their total costs over time are going to go down. And when healthcare going up 10 to 20% in health insurance costs every single year, and mind you, healthcare costs aren't going up that much, it's the health insurance. When health insurance costs are going up 10, 20% year after year, that's just something that most companies wouldn't accept out of any other supplier or vendor relationship they have. It's accepted as the status quo in health insurance. And we're just trying to fight back and push against that. So if you'd like to know more, let me know. Talk to us, LBL Group. We help companies across the entire country. We're focused in California, and we can help you get access to your data so you can control your healthcare. Thanks and have a good day.